Appreciate the opportunity, and I'm not being heard for some reason. Yes? Hello? I'm sorry about the confusion with the mic here, folks. This lecture is on the gut, and I am really excited about this. I love integrative medicine. I love nutrition and supplements. But what I've learned about the gut in the last few years is, frankly, mind-boggling. And I think that this lecture we're going to be talking about some of this mind-boggling thing just because it's so dang interesting and where medicine is going with regards to gut science and the microbiome. But we're also going to talk about some specific things that you can use in your lives and your patients' lives as well. So we'll both be ethereal and up here and real specific as well. I want to just double check. Are we okay in the back? Great. And I also want to, we're not going to have real long lectures here. I know this is the second to last lecture of the day. But if there's a question that you think is really important, not something, maybe personal, but something important that you think that everybody else would help them understand what I'm saying, please ask me during the lecture. Okay, we'll just keep everybody involved in this second to last lecture. And the clicker, where is that guy? So, the gut. Hippocrates said way long ago that after a lifetime of work, all disease begins in the gut. Now, I don't know if that's true, but I'll tell you, I think by the time we get through this lecture, you're going to say, a lot of diseases start in the gut. And I'm starting to get it. We took our dog in, not doing veterinary medicine here, but we took our dog in not too long ago. He was kind of droopy, didn't look good, having a little bit of mucus in his stool, and just really not doing well. The first thing the vet said is, what are you feeding the dog? What's going on? Is he getting table scraps? What kind of food you feeding him? So they zoned in on the gut within the first 30 seconds of talking to him about what was going on. We're going to look at the foundations of GI health, the gut bacteria, and its impact on health, which is amazing. Food sensitivities and systemic inflammation. Case studies in GI health. This is where we're going to bring it to the practical for you. Then we're going to look at some specific interventions for IBS and reflux, constipation, etc. So the gut, it is this amazing organ system. Starts at the mouth, ends at the anus. But digestion really starts here, because as we start anticipating or thinking about food or seeing it or smelling it, those digestive enzymes, the amylase in our saliva starts to be secreted. Our upper gut starts to turn on, pancreatic juices, the stomach acid. We start to chew the food. We even start breaking down the food by the chewing, but also the amylase that's in our saliva gets pushed through to our stomach. The pH of the stomach, as we talked about earlier, is 1 or 2 when the food gets there. It gets churned up and broken down, and it gets moved into the small intestine, where pancreatic enzymes, more amylase, and proteases, and lipases, and biliary secretions, and salts help us break it down into the component parts, the amino acids, the simple sugars. And it's from there that they transverse the 20 feet of the small intestine, and there's that miracle that happens, that we're able to absorb what we need, keep out what we don't need, and get everything we need for cellular energy and cellular repair. This small intestine is truly amazing. And along the length of the gut, we also have our microbiome, a little bit in the stomach, a little more in the upper intestines, a lot more as we get down towards the ileum, and trillions of bacteria in our colon. All along the way, that bacteria is interacting with our immune system. It's actually given our system, our nervous system of the enteric plexus, information about what's happening in the world, interestingly. Very important. And we know how the surface area is amplified, from the folds in the small intestine to the villi that line all of those folds, and the microvilli that line all of those simple cells. And we are protected from the outside world. The gut is, the food and the particles and the feces finally at the bottom is really the outside world that goes through the body. And we're protected with a 1 cell thick epithelial lining. 1 cell thick. And there's this condition that maybe you've heard of, leaky gut syndrome. In medicine, we call it hyperpermeability or impaired permeability of the gut lining. There's a one-cell thick epithelium. We need to take care of that. And we know that the surface area is immense, 3,000 square feet. And as I alluded to, we need that 3,000 square feet to be able to absorb all of those micronutrients we talked about earlier today. And also to glean information about what happens in the environment. So our microbiome can actually change because there's different foods available or there's different pathogens out there. There's an incredible mutability to our microbiome that changes the complexity of the human organism. So the gut is the inner tube of life. It's the outer world that traverses the body. And just one epithelial cell protects us from that outer world. It is the most prominent, the largest organ system of immunity in our body. 70% of the lymphocytes live around the gut. Things like B cells that create antibodies that put into the gut so it protects us, the secretory IgA. There's the T cells and the T regulatory cells that help fight infections and viruses and regulate the immune response. And real recently we discovered this cell, it's commonly known as the periscope cell, that has an appendage that can stick into the gut from the lamina propria into the gut lumen and measure and get an idea of the energy that's in the gut, but also pathogens. And it can even reach in there and select specific pathogens. And you'll be amazed in just a minute why it does that and how it does that in regards to the microbiome. And we know now that this, what we think is our second gut, our second brain is really our first brain, because there's more neurons in the enteric nervous system than there is in the brain itself. The biodiversity in the gut, the bacteria, the bacteriophages, the viruses, the parasites, the yeast, is far greater than the biodiversity of the rainforest in the Amazon. And it's this diversity that's partially responsible for the complex phenotypic expression of the human genome. The microbiome orchestrates the presentation, the expression of the human genome. And there's several ways that it does this. So one of the scientists that I've read recently said that the human genome of 23,000 pairs of genes recognize that the earthworm has 75,000 genes. The wheat that we had this morning, maybe with breakfast, has 150,000 genes. So how is it that the human genome is able to express the most complex organism on the planet? Well, it does that because it interacts with the genes of the bacteria, which is 150 times more genetic diversity than our genetic diversity. So if you're a person that is likely to get kidney stones, say calcium oxalate stones, and you eat a lot of, say, green vegetables with oxalates, well, what that does is it actually upregulates the expression of a bacteria in the gut called oxalobacter. And that then is able to break down the oxalic acid and you don't get the kidney stones. Another example of how this genetic expression happens, bifidobacteria produces when it digests fiber, indigestible fiber for the human, but the bifidobacteria can break it down. It breaks it down into short chain fatty acids, 4 carbons long butyric acid. This butyric acid can affect histone deacetylase, which affects histone and gene expression on the epigenome, and it can change things like our immune sensitivity, but it can also decrease our risk for cancer by its effect on tumor suppressor genes. This is how this microbiome affects things, and this is where I think it's fabulous and amazing, and I'm glad to be in medicine in 2016. So let's talk a little bit more specifically about this. So we know that the human microbiome now is a control center for human biology. We know that things like bloating and diarrhea can be caused because there are bacteria in the upper gut that ferment where they're not supposed to. They belong more in the lower gut, and that fermentation process causes increased fluid and increased gas in the upper gut and causes maybe diarrhea predominant IBS. We'll talk about the treatment of that in a little bit. If there are methane-producing bacteria in the upper gut, small intestinal bacterial overgrowth from methane, methane is an anti-peristaltic anti-peristaltic gas that slows down peristalsis and causes constipation. We know that if you have a lot of Firmicutes, bacteria of the phyla Firmicutes, that you're much more likely to be fat, because they're able to extract more energy from the food that goes through you, more likely to have metabolic syndrome. We know how to change that too, by the way. Eat a lot of vegetables and stay away from processed carbs. What about if you have yeast in your gut, like we all do, and it's overgrown a bit? The small molecules that the yeast release as part of their metabolism are absorbed through our gut lining into our blood, goes through our blood-brain barrier, and can affect appetite. These little critters can control our behavior. And through things like that short-chain fatty acid, butyric acid, it can affect immune tolerance in T regulatory cells. The right balance of the bacteria in our gut will make us, as I talked about earlier with that study of preschoolers, that can decrease respiratory infections and GI infections. And I just mentioned briefly about how through the histone deacetylase enzyme, that short-chain fatty acid can decrease our risk of cancer systemically. We are a superorganism, a human being and a whole lot of bacteria. And the question is who is ruling the roost? Is it the bacteria or is it us? July 2016, this is a journal of oncology, and what they talked about is that symbiotic bacteria, specifically the bacteria Lactobacillus reuteri, can decrease inflammation in the body and decrease cachexia in cancer patients. So cachexia is an inflammatory condition that can be mitigated with Lactobacillus reuteri. Here's another, this is in a 2016 journal Nature. They say that there is a remarkable role of diet, gut microbiota, and their metabolites, like the short-chain fatty acids, in the pathogenesis of several inflammatory diseases: asthma, arthritis, inflammatory bowel disease, colon cancer. So how do we cultivate this wonderful microbiome? Well, it's the mother's microbiology, and we thought that it was just when the baby went through the birth canal. But now we know that the mother transfers specific bacteria through her bloodstream via that periscope cell that pulls out that bifidobacterium, puts it on a transfer protein, goes to the placenta, goes to the amniotic fluid, and seeds that baby's gut and the respiratory tract. We know that the baby gets a lot more lactobacillus when it traverses the vaginal canal. We know if it has breastfeeding, that same periscope cell takes the bifidobacteria, transports it to the mother's milk through the breast to the baby to seed that baby's gut. These bacteria are so important, so vital. And we also know if that child gets dirty, lives on a farm, has a bunch of dirty, playful older brothers and sisters, that they have a lot lower likelihood of atopic disease, asthma, as they grow old, and more or less autoimmune. This is, there's so many papers coming out, 3 or 4 here in the last couple of months. This is also from Nature. Airway microbiome at birth, August. Lactobacillus was decreased at birth in preterm infants that developed lung disease. Our results, taken together with other recent data, indicate a placental and amniotic fluid microbiome before birth. And that fetal acquisition is very important for airway development and protection. Now, is it just me, or are you guys excited about this? Isn't this amazing? So, some definitions: the gut microbiota. All of those organisms, the bacteria, the bacteriophages, the parasites, the yeast. Probiotic by the World Health Organization is a live bacteria that confers health. A prebiotic is the fiber that helps that bacteria grow. Needs specific fibers. These specific fibers, like we might get indigestible fibers from a great one, is artichoke. It specifically grows bifidobacter. It's like miracle grow for bifidobacter. We want that because we want bifidobacter in our colon so that we have less colon cancer. A symbiotic is something that has both a prebiotic and a probiotic. Sauerkraut is a great example. Yogurt is a great example of that. Dysbiosis And this is where things are really, really interesting. There are abnormal bacterial ecology in many different areas. Now we know that there can be an abnormal rhinal-sinal microbiota, an abnormal gut microbiota. Now it seems kind of far-fetched, but now we know that. But we knew that as physicians all along because we've been treating abnormal microbiota with let's say external ear infections. That's the microbiota out of balance. Or bacterial vaginosis in a woman. That's the microbiome out of balance. Let me tell you one that just was shocking to me in the last month or two. So there's a staph bacteria called Marcons, methicillin-resistant, coagulase-negative staphylococcus. And if you are a person that has that residing in your nose, in your rhinal-sinal microbiota, you have an increased risk of Alzheimer's disease and chronic inflammatory conditions. We know now that Alzheimer's is split into at least 3 different categories. One is highly inflammatory, related partly to this. Amazing, amazing. And I'll tell you, if you have patients that have persistent crusting in their nose, they're much more likely to have chronic sinusitis, and they're much more likely to have other inflammatory conditions and autoimmune diseases. You want to treat them. You want to get that staph out of there. So it's always staph. It may not be Marcons, but it's almost always. So the pillars of GI health: digestion, relax and chew and let those enzymes do their work. The gut lining integrity, non-steroidals, alcohol, food sensitivity, stress, all tear up the gut lining. Probiotics help that gut lining. And that gut lining is so important to protect us and also to absorb. The microfloral balance. We need to avoid antibiotics. Antibiotics were a savior of many lives in the 20th century. We as physicians of the 21st century need to really know how to use our antibiotics carefully because we need to protect this microbiome. And of course we need to eliminate on a daily basis. So GI Health 101, you chew your food, it's exposed to the acid like we talked about, digestive enzymes, and then it's ready for extraction. And there's a probiotic biofilm that's on the top of those microvilli. Remember what I said about foods that have, I'm skipping on the word, the dissolution agents that bring together both the fat and the water. Those break down that biofilm. So the perfect pathway is that the food is broken down to the component part, the amino acid, the simple sugar. It's absorbed through that single layer of epithelium. It goes through the lamina propria, hits the blood vessel, and it's available for cellular energy and cellular structure. But if there's stress and alcohol and non-steroidals, things like that, larger molecules, macromolecules, polypeptides and oligosaccharides slip through and get into the lamina propria and start to interact with our immune system, causing systemic inflammation. There's another slide of that. So again, if you have, I'm having some feedback here. If you have some of the stressor on that epithelial lining, we get these larger macromolecules that come through. They can interact with the immune system, the T cells. You can get a condition called molecular mimicry, where that polypeptide that slipped through may have some homologous relationship to the polypeptides, say in the thyroid. You start developing IgG, antibodies, that can then maybe cause Hashimoto's thyroiditis. Or if there's homology to the joint surface, rheumatoid arthritis. There's no question that the health of the gut lining is very involved in autoimmune disease. Another condition, if you have some problems with that barrier and big chunks of bacteria slip through, like the LPS lipopolysaccharide membrane of gram-negative bacteria, the endotoxin, that also can slip through, get showered to the liver, causes chronic inflammation, increases our LDL cholesterol, right? And it also causes insulin resistance. We need to protect our gut lining. All of this, which seems, I don't know, just amazing. This is all documented science in the last 15 years. Bifidobacterium is particularly beneficial. Part of the benefit of the short-chain fatty acids is it can help seal that lining. It can seal the tight junctions. It can activate T regulatory cells that turn down inflammation. and it can reduce cancers. We talked about the histone proteins and the epigenome and how it works. There are now some advanced functional medicine tests that teach us more about how to glean what's going on with this hyperpermeability. Nutritional testing, stool testing, food sensitivity, small intestinal bacterial overgrowth, and there's even testing now for intestinal permeability. Now the nutritional testing I kind of showed you, this is the NutriVal test. It's about a 12-page test that looks at a whole lot of different micronutrients. And this person had low B vitamins. People that have low B vitamins often have some sort of enteropathy of the small intestine, because most people are eating some foods with B vitamins. They could have some atrophic villi, so they're not absorbing. They could have bacterial overgrowth. The bacteria can usurp the B vitamins before they are absorbed, and lead to that. Now, we can also measure in the urine information that tells us about bacterial and yeast overgrowth in the gut. And the way this works is that these bacteria and yeast create these small molecules that are absorbed through the gut lining, get into our blood, and are discharged in the urine. Arabinose, for example, is very common, elevated in the urine when there's yeast overgrowth in the gut. And it's not surprising that there would be yeast overgrowth in the gut. We've seen it in the esophagus, in the mouth, in the vagina. We know it happens in the human body. It happens in the gut too. We can measure that. There are also other small molecules that we can measure in the urine now that tell us about bacterial overgrowth in the gut as well. This is a food sensitivity test. Now, we're all used to IgE food sensitivities. An important one is IgG, and we'll go into that a little bit. This is IgG. And if you have barrier function problems and you start having macromolecules slip through from wheat or dairy or soy, you start to develop the T cell antigen presenting cell gets activated, then the B cell gets activated, then you get immunoglobulins that are secreted. This causes some chronic symptoms in people. We can look at stool testing. The stool testing can tell us about the diversity of the microbiome. It can tell us about if there's enough pancreatic elastase. You can measure pancreatic elastase in the stool, and if it's low, there may be pancreatic exocrine dysfunction. This is an interesting test. Has anybody heard of a small intestinal bacterial overgrowth breath test? So this has now been available for more than a decade. And what we do is we give people that we suspect may have bacterial overgrowth, and we think 35% of the people with IBS have that. What we do is we give them a lactulose food packet. Then we measure their exhaled air from their lungs every 30 minutes, sample it for about 2 hours. If they secrete hydrogen, that means they're fermenting in their upper gut that lactulose into hydrogen, and then it's excreted into the lungs. And so the hydrogen may be positive. If instead they're methane producers, there are methanobacteria that don't belong in the upper gut, that are fermenting food instead of fermenting where they should be down in the lower gut, that those methane producing bacteria cause methane, and we know now that methane is anti-peristaltic. Now, this is a very new test. This is a test to look at hyperpermeability of the gut lining. And we look for IgA and IgG antibodies to proteins called zonulin and occludin. Zonulin and occludin are the proteins that form the tight junction between the cells of the epithelial barrier. When they break down, they are exposed to the immune system. The immune system creates antibodies to it. It tells us about leaky gut. It's measurable now. We can also look for antibodies against LPS, lipopolysaccharide, the endotoxin. Tells us about hyperpermeability. So now we know that this hyperpermeability is linked to autoimmune disease. People with celiac, 5 to 10 years before they develop the clinical symptoms, have elevated zonulin antibodies. Crohn's disease, type 1 diabetes, schizophrenia, autism, and cancer. And I'm just going to go back to the autism and schizophrenia because I find this immensely fascinating and something that we're going to be able to change people's lives with. It turns out that those tight junctions that are in the epithelial lining of the gut, they're also in the blood-brain barrier. And these people that have dysfunction with zonulin right, can also have a leaky brain barrier. They're much more likely. We know, and pediatricians have known for decades, that kids with autism have gut problems. They often have food sensitivities, they have seasonal allergies. This is interesting how it's all coming together. This was discovered by a man named Alessio Fasano, professor at Harvard, pediatric gastroenterology. This guy's going to get a Nobel Prize, I'm almost positive. Fantastic research. So when food's the enemy, we know we all seen IgE-related food sensitivities, hives and swelling and breathing trouble. We're not talking about that here. We're talking about primarily IgG-related sensitivity. If a person has IgG-related sensitivities, they can have a myriad of different symptoms, from fatigue to joint pain to eczema, lots of different things. These are the most common food sensitivities: wheat, dairy, eggs, sugar, soy, and processed foods. Wheat's the biggie. And the reason wheat is a biggie is because it unlocks the tight junctions in every human being. Some people more than others, but in every human being. I'll show you the data behind it. So the way that we, in integrative medicine and functional medicine, try to solve this little problem, big problem, is we use the 4R program. We remove processed foods, allergenic foods, and often FODMAP foods. And FODMAP foods, I'll explain to you, that makes a big difference, and I'll list those in a minute. And we try to get rid of noxious bacteria and yeast. We replace digestive enzymes if their pancreatic elastase is low, and we make sure they've got good stomach acid. You know, as we get older, we get atrophic gastritis. We often don't have enough stomach acid. That's one of the reasons elderly people have trouble with iron and B12 and amino acids. We help heal the gut by using things like zinc and glutamine and IgG. You know, there's a medication out now called Enterogam. Maybe you've seen that. Some of the gastroenterologists are using it. It's an IgG that you give orally that helps support the gut barrier and decrease problems with pathogenic bacteria. And then we re-inoculate with good bacteria and lots of prebiotics. So for most people, you want them to eat these sorts of foods, real food, not this. So let's look at the case studies, and I'm going to get a drink here. So this was a 21-year-old that I saw in June. Chronic sinusitis since his teenage years, college student, frequent antibiotics, reflux and diarrhea. Did some testing. I looked at the celiac, it was negative. But his IgG foods were positive, so he wasn't positive for IgA-TTG, for celiac, but he had IgG positive for wheat and dairy. I took him off those. The interventions: wheat and dairy-free diet, and nutrient-dense and colorful. He had some dysbiosis on therapy, so I gave him an herbal antibiotic that I'll show you in just a minute. I put him on a multivitamin, some vitamin D, some probiotic with bifidobacter in it, and some omega-3s to lower inflammation. In 1 month, folks, in 1 month, this kid was markedly better. And he's an intelligent young guy that was just struggling with this. In 1 month, he was better. You can do this in your clinic. Get him off the inflammatory foods. Do a trial. They don't have to stay off forever, but get them on a probiotic, get them off the wheat and the dairy, and see how they do. This is the herbal antibiotic, and it has things in it like acrylic acid, which is it's a short chain fatty acid that's antifungal. It has zinc in it that's good for the gut lining. It had oregano and oregano oil and garlic. All of those put pressure on pathogenic bacteria and decrease small intestinal bacterial overgrowth. Very safe, very safe. I want to let you know that now when you buy antibiotic-free chicken, you know how you'll see those at the store now? Well, you know, the food industry is deceiving us there. They're not giving them tetracycline anymore. They're giving them oregano oil. And the reason they do that is they know if they give chicken or if they give cattle antibiotics early in their life that they grow about 20% faster and larger. That's why they do it. And so eventually we're going to have to get them to get that oregano oil out of there too, because that's still going to shift the microbiome in a way that's going to create resistant bacteria. Case number 2. This is a woman that had 3 years of frequent diarrhea after gallbladder surgery. So you think maybe she's having some bile salt related diarrhea. She's a female business executive. We did a stool culture in O&P, negative. We did celiac testing, negative. IgG food testing, negative. When we did a colonoscopy, she had chronic nonspecific ileitis. When I did the small intestinal bacterial overgrowth breath test, it was positive for diarrhea. So we know that bacteria that produce hydrogen in the upper gut cause diarrhea, predominant IBS. Interventions: wheat-free, dairy-free diet, nutrient dense. Everybody, we use that a lot. It's very beneficial. Dysbiosis therapy, you know Xifaxan. Xifaxan is that powerful antibiotic that's not absorbed through the gut, but it's very good at the treatment of small intestinal bacterial overgrowth. I gave her the Xifaxan for 2 weeks. I put her on a probiotic, and in 2 months, this woman's diarrhea that had been there for 3 years was gone. It was gone. This is a 30-year-old female, an occupational therapist with bloating, constipation, and irritable bowel syndrome. Celiac was negative. IgG foods, though, were positive for wheat and dairy. Nutritional testing and other testing suggested bacterial and yeast overgrowth. She had methane-producing bacteria. Constipation. Interventions: a wheat-free, dairy-free, and a low FODMAP diet. FODMAP foods cause gas. We'll talk about that because it's a big deal in regards to reducing these people's symptoms. Dysbiosis therapy. We use herbal antibiotics that I showed you, and we used a coconut oil extract called lauric acid. It's a carbon-12 extract from some medium-chain triglyceride from coconut oil that's antifungal. And we gave her supplements of magnesium citrate to help her move her bowels better. We got her a squatty potty, and I'll show you which one of those what that is in just a minute. And in 2 months, she was markedly improved, and she was best when she was following the dietary recommendations. Squatty potties can be helpful. They can create one themselves at home with a little bit of stool. What it does is it changes the geometry of the sigmoid colon, so it's more of a straight shot, and you're not so dependent on that levator ani muscle, and you can just eliminate more fully. So this is another local business owner, 39-year-old with fatigue and headaches for a couple of years, getting worse, and just had enough. Standard labs: thyroid, vitamin B12, celiac was negative. She did have some IgG food sensitivities. I did a sleep study because of the fatigue, that was negative. What I did for her, although she didn't have specific IgG sensitivities to wheat or dairy, I still put her on a wheat-free, nutrient-dense diet, and I got her off the processed foods. She's sleeping and better exercise, that was helpful. And we put her on some basic supplements: a multivitamin, vitamin D, omega-3, and a probiotic. And 1 month later, she had marked improvements. Her headaches were virtually, I think she had 1 headache in that 30 days. I saw her just a few weeks ago. She's still not having headaches. She's feeling great. And so this is something you can do. I didn't have to do complicated testing here. Everything is available to you there. It was a challenge off wheat and dairy and processed foods. Those things are tough on the gut on many, many people. Eliminate. Thank you. So the question was, did I do anything particular for sleep? No, I didn't, but I did tell her to just pay a little bit more attention to it because, she was helping kids with homework and then doing other things to try to finish up later, getting to bed at 12 and up at 6:30, and that was not enough. So yeah, just a little bit more attention to sleep. This is a woman that has rheumatoid arthritis, a 49-year-old. She's a lab technician, a wonderful woman, and she was just hurting all the time. And she was on medications, methotrexate and others. Celiac was negative. IgG foods, many positive IgG foods. She had leaky gut syndrome. medical parlance, hyperpermeability of the small intestinal lining. She also had on stool culture, she had a bacteria named Prevotella copri, related to rheumatoid arthritis. Interventions. I put her on what is called the autoimmune paleo protocol. It is hard to do. No wheat, no dairy, no nightshades, no nuts. So she was eating meat and vegetables. Treated her for dysbiosis, the abnormal gut bacteria, for 4 weeks. Supplements of vitamin D, probiotic, omega-3s, some glutamine for the gut lining, curcumin for inflammation. And there's a drug we use off-label called naltrexone, and we use it in very low dose because it modulates T-cell immune response. You give it at night, it modulates the response, turns down some of the immune. She was markedly better. 2 months, much less pain, less swelling, decreasing methotrexate. She is very pleased. We can do some things about autoimmune diseases in our patients. We know now that many of these autoimmune diseases, before they show up symptomatically, we can start to see it in the blood. We can start to see rheumatoid factor 6, 7, 8 years before. The reason we know that is because we have blood from military recruits that went on to develop lupus, or on to develop celiac, or on to develop rheumatoid arthritis. Go back and look at their blood. The antibodies are there because they had leaky gut, created antibodies, had the genetic susceptibility, and away they go. This is a really simple one. 53-year-old woman with reflux and fatigue and high cholesterol and prediabetes. Do you have any patients like that? Well, what we did for her is very little testing. We said, how about eating a nutrient-dense diet, low carbohydrate diet, few processed foods? And I asked her to emphasize vegetables and meats and fish and berry, and to get rid of the processed foods. I put her on time-restricted feeding. We talked about that in regards to breast cancer, but we know that time-restricted feeding where you eat 11 hours a day and you're off for 13 is very good for metabolic syndrome. In 2 months, energy up, bloating and reflux gone. Bloating and reflux were gone. Down 6 pounds, hemoglobin A1C was down to 5.6, lipid parameters are normal. You can turn these people around, it's not hard. The time-restricted feeding is cool because in that study they did with the women with breast cancer, not only did their breast cancer recurrence improve significantly, their sleep improved, their reflux improved, their CRP inflammation improved as well. So in other words, what I teach these people, all of them, is to get off the carbonated sweetened drinks, get off the refined sugars, get off the artificial sweeteners, colors, and flavors, get off the processed foods, or in other words, get off the crap. You know, many of our patients are eating poor quality food-like products. Get them on real food. It's amazing the beneficial benefits of that. Are we having some trouble there? Can I continue? Okay, so I'm going to talk about gluten-related disorders. This, of course, is an iceberg. And celiac disease is 1% of the population. What we see for celiac is just the tip of the iceberg in regards to wheat. And I need to tell you this too. I listened to Dr. Peter Green, our nation's most respected researcher in celiac. He's from Columbia University. He said the other day that we, us physicians, we diagnose 17% of the celiac cases in America. That means 83% of the celiac cases out there go undiagnosed in America. We're one of the worst countries in the world. Finland diagnoses well more than 40%. Australia, much more than 30%. We can do better on that. We need to be thinking about it. And the other thing he said to really take home here is that most people in America today with celiac do not present with GI symptoms. They present with anemia and fatigue and eczema and headaches. So think about it. Order it. The other thing to know is that there are other sensitivities. About 5% of the population have non-celiac gluten sensitivity. Some of those patients I showed you had that. This is a recent study in the journal Gut, July 2016. Intestinal cell damage and systemic immune activation in individuals reporting sensitivity to wheat but having no celiac disease. This is really there. I know you have patients like this, and you probably respect what they say, that the wheat bothers them, right? Well, here when they measured, CRP and other things, they can prove that these people are having an inflammatory response to wheat that is non-celiac. And why is that? This is the gluten molecule. The gluten molecule is unusual because it can stretch. That's how we get these wonderful French breads that rise, right? It's according to Dr. Fasano, the fellow that discovered zonulin, he said that no human can fully digest gluten. That the blue section in the middle increases permeability in everyone. That big chunk polypeptide in the middle. That doesn't mean that we all need to be off wheat. There's different genetic susceptibilities and environmental loads, but it affects all of us. And gluten is perceived by the immune system as a chunk of a microorganism. That's why we so aggressively fight it. If people go gluten-free, if they eat this food here, this processed gluten-free food, in fact, if it says gluten-free on it, it's probably one of those poor quality foods. This is what you want them to eat. High quality, real food that just happens to not have wheat in it. Let's move to reflux. 1 in 5 of our patients have GERD, at least. There were 100 million prescriptions of the PPI per year. Dr. Castell, who's an author for the American College of Gastroenterology, said, if we took 100 people with reflux and got them to rigidly follow lifestyle recommendations, 90 out of 100 wouldn't need medication. So in reflux, we're treating the symptoms, but not the cause. So to treat the cause, you got to get people to eat earlier in the day and a lighter dinner. They need to chew their food. They need to remove processed foods. And many people, if you get them off grains, particularly wheat, their reflux will get better. You need to make sure they don't have food sensitivities to wheat and dairy. They may need digestive enzymes. Antacids can certainly be helpful. And interestingly, chewing gum after the meal will continue to facilitate digestion. You get more salivation that actually washes down reflux. So that, as long as they're not a person that chews gum and gets a lot of aerophagia, then it's a totally appropriate thing to do. So the purple pill is a powerful medication, and it's powerfully beneficial, but powerfully potentially harmful. These are known side effects: iron deficiency, pneumonia, increased heart disease, small intestinal bacterial overgrowth. You need acid in your upper gut to keep down bacterial overgrowth in the duodenum. Magnesium deficiency, increased infectious diarrhea, and osteoporosis. And for some reason, I didn't put cardiovascular disease. In the last 3 months, there was a study that showed why PPIs increase cardiovascular disease. Because there's proton pumps on the epithelial cells of our cardiovascular lining, the endothelial cells. And those proton pumps help rid the body, those cells in that lining, of oxidized LDL. There's increased cardiovascular disease and stroke in people using PPIs. It doesn't mean we shouldn't use them. We need to use them selectively, and we shouldn't put somebody on them and allow them to stay on them forever. We should encourage the lifestyle things that we talked about, because 90% of those people will get better with lifestyle interventions, says the editor of that journal. This is a favorite reflux product that I use. It has calcium in it, a little bit of calcium carbonate. It's got things like aloe leaf, which is really good for the gut lining. It's got a little chamomile. It's got a little licorice. And it turns out licorice, it helps heal the gut lining as well. Okay, so we'll bring this into irritable bowel syndrome a little. We know what it is. You have change in motility, you have pain. It's a persistent, recurrent problem in people. Clearly a motility issue with diarrhea or constipation or bloating. Hypersensitivity. We know that these people have some hypersensitivity of the enteric plexus. Many of them have food sensitivities. And now we know that 35% of them or so have small intestinal bacterial overgrowth. This is New England Journal of Medicine data. So to treat IBS, you want to remove some of the offending foods, the wheat, the dairy, the processed foods. That helps a lot of folks. It doesn't mean they need to be completely off wheat if they don't have serological evidence of it, but you reduce the wheat, you reduce the dairy. You treat the motility. If they have constipation, you use magnesium. I like magnesium citrate. Probiotics help that. Diarrhea, obviously fiber and probiotics interestingly help that as well. Treat the infections, the offending bacteria and possibly yeast. I showed you that case of diarrhea predominant IBS where we use Xifaxan. Sometimes I also use diflucan if there's the right cause for that or data for that. Sometimes I use those herbal antibiotics. I have great benefit and effect with those. Then I repopulate them with good bacteria. Some people call it repopulate. And then we relax the gut. Peppermint and chamomile, those herbs relax the gut through a calcium channel mechanism of the smooth muscle. This is just specifically about probiotics, how the number needed to treat is 4. 10 to 40 billion units. And the particular bacteria are Lactobacillus and Bifidobacter infantis have been particularly helpful in IBS. This is that New England Journal study about diarrhea predominant IBS. This is Dr. Pimentel from California. 35% patients with IBS have SIBO. Interestingly, that many of the conditions we treat in our clinic every day may be related to small intestinal bacterial overgrowth. These are also studies. IBS, fibromyalgia can be related, chronic fatigue, restless leg syndrome can be related to small intestinal bacterial overgrowth. Rosacea. Is it interesting that when you give somebody with rosacea tetracycline, they get better? What is it treating? Is it in the skin or are they doing something to the gut? IBS treated with a low FODMAP diet. This is something you definitely want to take home with you. Easy to teach your patients. So FODMAPs include gluten-rich grains, high lactose dairy, legumes, and certain fruits and vegetables. If you put somebody with IBS with gas and bloating on a low FODMAP diet, 52% of them get better. These are FODMAPs. They're fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So you can see that Brussels sprouts and broccoli and bread and lactose and fructose and sugar alcohols. This is a wonderful lecture from Dr. Peter Gibson from Monash University in Australia. It's about an hour long. It's free on YouTube. He's got a great book. This is used around the world on helping people with IBS. FODMAPs made simple. Get them off the wheat, the dairy, the onions, and processed foods. Get them on lettuce wraps and almond milk and infused oils and nut flour instead of, my wife Terry makes some of the best pancakes in the world. And they're made from almond flour. They're just amazing. They're great. And so you don't have to have that necessarily. These are high FODMAP foods. A little bit about constipation. And I'm just going to kind of go through this. Remember that water and probiotics. And remember magnesium citrate. I use magnesium citrate. It's very safe. It's in capsules. Very safe, very effective. 2 to 8 capsules a day. I tell the patients to start with 2 each night and then increase it until you have a normal, daily, satisfactory bowel movement. Really works, really safe. Thank you. You can also use powdered vitamin C. There's something called the vitamin C flush. Vitamin C can only be absorbed at about 500 milligrams per time of exposure. If you get powdered vitamin C and you tell them to start with about 5 grams to take it down, they get the powder. It's not harmful, but it will cause diarrhea. And so some of these people that really get backed up, I'll tell them on a Saturday, start with 5 grams. If that doesn't do it, take another 5, maybe even take another 5, and they will clear themselves out very nicely. And then once they're cleared out, they're in a good rhythm. Now you could use Go Lightly for that too. I like vitamin C better than Go Lightly So how do we disrupt our microbiome? It's the Western diet. It's allergenic and food intolerances. It's antibiotic prescriptions. We need to work on that. We all need to work on that and take the extra time to counsel our patients that they don't need it for that viral syndrome. Stress, proton pump inhibitors, because they decrease the acid in the stomach and in the small intestine, much more likely to have overgrowth. Microbiome restored, you need to eat vegetables. There's no question the biggest thing that makes a difference is the fiber from vegetables, because we select specific growth of lactobacillus and bifidobacter. That's the most important thing. You can use fermented foods like sauerkraut. You can take probiotics. I recommend both of those. The prebiotics are in the plant fiber, and you want to avoid antibiotics as much as you can. And you've all heard about the fecal transplants. That's going, that's definitely in the research institutions for lots of different things, including things like multiple sclerosis and autoimmune disease. There's studies going on where they give them a fecal microbiome transplant. For autism, they're also using fecal microbiome transplants. I'm going to leave you with a couple of probiotics that I really like. Align is that Bifidobacteria infantis. So this is something you can recommend to your patient. It's available. And I'm not selecting this particular brand, but I just want you to know that it's out there. Culturel has Lactobacillus GG, and it also has a prebiotic fiber in there called inulin. And these days they're putting prebiotic fibers in our baby's formula. I'd rather have the baby drink that breast milk, but it is interesting that we know how important these prebiotics are. Flora Store is Saccharomyces boulardii. This is one of the very most important probiotics. It definitely can reduce antibiotic-associated diarrhea in a big way. And I don't think I'd ever put anybody on Levaquin without putting on Saccharomyces boulardii at the same time. And then VSL3 has 300 billion units. So you might use that for people that have really bad gut-related things, Crohn's disease possibly, pouchitis. And that's the end of this lecture. And I think we're just on time.